Hi, my name is Kevin Matthews, and today I'd like to discuss with you the attributes and the benefits to the Texas Turbo design for triplanar control of foot and ankle issues. The Turbo design is an innovation that we came up with. It's a variation on a floor reaction design, but what I was after was better triplanar control with minimal plastic and maximum rigidity. How we came up with this, and that's kind of a long story, is we managed to come up with a technique where we're able to use one long polypropylene strut to reinforce the overall frame or AFO. What it does is it adds maximum rigidity while allowing us to remove a significant amount of plastic. And what I would like to do is just discuss the benefits of this design, incorporating it in your practice, and using us for fabrication if you don't have the ability or time or inclination to make these in-house. I don't really consider it a floor reaction AFO, although it can be used for your typical indications for floor reaction design, which are to correct crouch gait, to support weakened quadriceps or at the knee, so if the knee has a tendency to buckle. All the floor reaction indications are there. But the primary reason that I use it is for triplanar control. Again, it's a pretty wide open design. We have two options, basically, a air turbo and a standard turbo. The air turbo works just fine. You wouldn't want to use it for chronic Achilles issues, which is a common use for this design. The more chronic Achilles issues where casting or a boot for 3 or 6 weeks haven't worked. Other diagnoses that I've used this for, and I use it for almost exclusively to other designs, posterior tibial tendon dysfunction requires triplanar control because of the midfoot collapse, forefoot abduction, and calcaneus sliding off into valgus, internal rotation of the tibia. So that's an internal rotary deformity or internal rotary presentation. External rotary presentation would be where the patient walks on the outside of the foot, the tibia externally rotates, heel slides off into varus, forefoot has a tendency to go into adductus. It works fantastic for both designs. I find for the external rotary deformities, I will sometimes add a dynamic force strap, which is a slot cut through the plastic to get a medially directed force from a dynamic strap to correct that. I don't typically use dynamic force straps for internal rotary deformities. Probably the three most used diagnoses are Achilles tendonitis or tendinosis or tears, posterior tibial tendon dysfunction, and osteoarthritis or chronic inflammatory pain of the foot and the ankle that motion elicits. So by eliminating motion, it's like putting them in a cast, and we have significant, fantastic results with decreasing patients' pain, 80–90% in most instances. Other diagnoses where this may be indicated are plantar fasciitis, significant plantar fasciitis strains and tears, also chronic acute plantar fasciitis, one that hasn't responded to other treatments, has been around for 6 months to a year and is not resolving. I have done a few for chronic plantar fasciitis. What's great about the Turbo design is it's made from polypropylene, a material we all know and love. It's able to be heated and modified, and I will be doing a video on different modification techniques for fitting. Also, when we make them and when you get them fabricated through us, we always use a padded foot plate. We use 1/4 inch microcell puff, 35 durometer. We vacuum form the plastic over it. It compresses to about 3/16, which means that compression makes the durometer increase. This insert lasts for years. We've been making this design for well over 3 years now. We've never had to replace a padded foot plate due to tear or no longer functioning properly. We have gone back and added some padding if it just gets too hard, but it's very rare that we even do that. So remember, for IRD, ERD presentations, chronic diseases like Charcot-Marie tooth, Guillain-Barré. The diagnoses are endless for this design. I use it. I make hinged AFOs, I make solid AFOs, I make leaf spring AFOs, I do the carbon fiber AFOs, and I would say that fully 60% of all of the AFOs we make for adults are turbos. I've been using them in the pediatric population, although I haven't thrown it into the mix quite as much because their leverage isn't near as strong as in adults. You just don't need this much rigidity in the pediatric population. There are a few instances which I'm not going to go over today. Also in the AFO we add P-cell, which is a 20 durometer soft foam padding. We use that in malleoli, proximal tibial section, and in the arch area. What's great about P-cell is anywhere you're getting pressure, it will leave a mark or an indentation or a sock line. So if a patient's complaining of arch pressure, you'll be able to see right where it is and grind a little relief in there, or add a pad around that area to increase pressure in another area to relieve that area. So fitting and adjusting this design is much easier than, say, the laminated designs, which are very difficult, if not impossible, to adjust. You really should try the Texas Turbo in your practice. I think you'll find that it works out very well. The triplanar control, capturing the tibia proximally, minimizing tibial rotation, the trim lines extending past midline anterior to control valgus and varus issues, well-molded heel, arch, long lateral trim in the forefoot to limit forefoot abduction for IRDs. Many good reasons to use this design. Now it does end up costing your patient a little bit more because reimbursement's about, Medicare allowable is about $350 higher than a solid ankle design, but I really believe that it's worth the extra money that if your patient has a copay that needs to pay, just for the outcomes and the benefit to this design. If you have questions on coding or billing, feel free to call. I don't want to take up too much of your time, I probably already have, but think about the Texas Turbo, incorporate it into your practice, you won't regret it. We do beautiful work and stand behind it, guarantee our work. Thanks and good luck.